my name is Ryan Terlouw, and I'm one of the plastic and reconstructive surgeons at Muskegon Surgical Associates. Today I'm here to talk to you about facial fractures. So facial fractures are a relatively common thing that we see after car accidents or falls or other sorts of trauma. Unfortunately, they often happen with many other injuries, and so if you're suspecting that you have a facial fracture, it's a good idea to go to the emergency room to be evaluated for other injuries. And so if you go to the emergency room and you've had trauma to the face, the most important thing is that we rule out that your cervical spine is okay and your brain is okay. And so that will often be performed with x-rays of your neck as well as a CT scan of your brain. While they're there, they also perform a maxillofacial CT scan to evaluate the bony structure of your face. One of the most common facial fractures that we see is the nasal bone fracture. And so part of your nose is cartilaginous, the upper part of your nose is bony, and if you have a fracture like this, you'll often be quite swollen and your nose will be deviated off to the side. If the nose is deviated or you have asymmetry or difficulty breathing, the best time to fix a nasal fracture is within the first 1 to 2 weeks. We often wait 1 week for your swelling to go down, and then we proceed to the operating room for a quick outpatient surgery to get your nasal bones back in the proper position and give you back symmetry and improve your breathing. One of the next most common fractures that we see after car accidents or falls is an orbital floor fracture. And so your orbital floor is what supports your eye within the eye socket. Because this is a very thin bone, as you fall and hit your cheek, this acts as a blowout to protect the pressure and limit the amount of pressure that can be placed on the eye itself. The big problem with an orbital floor fracture is if the fracture moves or drops, your eyes are at different levels, and that gives you double vision. The other important thing about an orbital floor fracture is that you see an ophthalmologist to rule out any injury to the globe itself and evaluate your visual acuity. Most orbital floor fractures do not require treatment with surgery, but if you do have a big enough fracture or big enough hole in the floor of your orbits, then we do need to fix that to prevent what we talked about, the double vision. One of the next most common things that we see are maxillary fractures or fractures of the frontal bone. And so those are similar in nature. They happen from high energy accidents, so like motor vehicle accidents or fall from a ladder are some of the most common things that we see. These are again evaluated by a CT scan in the emergency room, and if they do require treatment, we often fix them at about a week after the injury to allow your swelling to get better. Most of these injuries are able to be repaired as an outpatient basis. Typically, you go home the same day after surgery. The post-operative care for these fractures is quite minimal. For the first week or two after surgery, you have some facial bruising and swelling. That's quite similar to the initial injury itself. Afterwards, if you have a nasal fracture, we'll put a nasal splint on you to protect that. The remainder of your facial fractures do not require any splinting. The sutures come out in the office typically at 1 week after surgery, and we place you on antibiotics afterwards. The other important care after facial fracture surgery is that you do not blow your nose, and if you do happen to sneeze, you sneeze with your mouth open. Typically, most of these fractures are connected to a sinus, and so the sinus cavity with forceful breathing, sneezing, or coughing can force that bacteria in your sinuses towards the fractures. And that's what we like to prevent with the antibiotics and the sneezing protocol. If you're worried about a facial injury, like I said, we'd be happy to see you in the office to discuss your case. But with these injuries, it's important that you get a CT scan relatively shortly after your injury. Like we mentioned before, every facial fracture is unique. We're happy to see you in the office and discuss your case on an individual basis.